Greetings to my audience. My name is Q Chin, and I will be sharing about pulmonology. What is pulmonology? Pulmonology is a specialty that diagnoses and treats any diseases that affects the respiratory system. You might have heard of the term interventional pulmonology before. It is a subspecialty within pulmonology that focuses on minimally invasive diagnostic and therapeutic procedures. This subspecialty has grown significantly since 2001. Let us talk about the anatomy of the respiratory system. The respiratory tract is divided into upper and lower respiratory tract. The upper respiratory tract consists of organs outside of the thorax, such as nose, pharynx, and larynx, while the lower respiratory tract consists of organs within the thorax, such as trachea, bronchi, bronchioles, alveolar duct, and alveoli. In terms of its function, the respiratory system can be separated into two zones: the conducting zone and the respiratory zone. The conducting zone is from the nose to bronchioles. They form a path for conduction of the inhaled gas. The respiratory zone is from the alveolar duct to alveoli, where the gas exchange takes place. The main purpose of the biochemical process that happens in the respiratory system is to pull in oxygen for our body cells to produce energy and get rid of carbon dioxide, which is a waste product that is produced during the energy creation process. During inspiration, the diaphragm is pulled down, creating more space in the chest. Air is brought into the alveoli of lungs. There are blood capillaries surrounding the alveoli. Oxygen diffuses into the blood capillaries, while carbon dioxide diffuses out of the blood capillaries into the alveoli for expiration. Now, the blood is oxygenated. The oxygenated blood circulates throughout the body and reaches cells that are metabolically active. Oxygen diffuses into the cells, while carbon dioxide diffuses out of the cells. The disease that I would like to share about is called obstructive sleep apnea. Obstructive sleep apnea is the stopping of breathing when someone is sleeping. It is caused by upper airway obstruction during sleep, hence leading to intermittent hypoxia. The obstruction can be partial or complete. The collapse of the upper airways is due to the change in airway muscle tone. Obstructive sleep apnea is a major contributor of cardiovascular disease, and it is also associated with hypertension. OSA is the most prevalent and clinically significant sleep disordered breathing. Unfortunately, OSA is more prevalent in men than women. Actually, most patients who have OSA are asymptomatic. However, patients would usually complain of excessive daytime sleepiness, loud snoring, drooling, nocturnal gasping or choking, and headaches. Fun fact, obesity is the most common findings in individuals with OSA. It may be due to adipose tissue deposition in the oropharyngeal around the upper airway that contributes to apnea. There are numerous risk factors that are associated with OSA. The Stop Bang questionnaire is widely used for screening, which stands for snoring loudly. By loud, we mean louder than talking or can be heard through closed doors. If we often feel tired during daytime, observed stop breathing by a third party, high blood pressure, BMI 35 or greater, age 50 or above, neck circumference greater than 40 cm, gender if you are a man. If yes is being answered for 3 or more items, there is high risk. Now we will talk about how severity is determined in OSA. If there are 5 to 15 events of airway collapse or breathing disorder that happens in 1 hour, it is mild. If there are 15 to 30 events per hour, it is moderate. And if there are more than 30 events per hour, it is considered as severe. I have found different treatments that are in different categories for OSA. They are lifestyle changes, positional therapy, positive airway pressure therapy, oral appliance, and surgical treatments. We will start with lifestyle changes first. For obese and overweight patients, weight loss is encouraged. But weight loss is usually not curative, it only decreases the severity. Patients should sleep 7 to 8 hours per night. They should avoid alcohol, antidepressants, and doing drugs. OSA that is more prominent in the supine position can be treated with a positioning device to keep a patient sleeping on their side. The most effective treatment for adults is continuous positive airway pressure. I will call it as CPAP in my presentation. However, the biggest issue with this treatment is the lack of adherence. Nearly 50% of patients stop using CPAP within the first month despite education. Another therapy which is better tolerated by patients is bilevel positive airway pressure. For patients who are unwilling to use CPAP or unable to access reliable electricity, an oral appliance called mandibular advancement devices can be used. Mandibular advancement devices can bring the lower jaw forward and relieve airway obstruction. It was superior to CPAP for improving quality of life measures. Last but not least, we will talk about the surgical treatments for obstructive sleep apnea. Uvulopalatopharyngoplasty is a surgery that removes the uvula and tissue from the soft palate to create more space in the oropharynx. However, the long-term efficacy of the uvulopalatopharyngoplasty surgery is very limited. Another surgical treatment is called maxillomandibular advancement. It detaches both the upper and lower jaws and surgically advance them forward to increase space in the oropharynx. Before the surgery, drug-induced sleep endoscopy can be used for preoperative planning to identify multiple levels of obstruction. These are the references I have used for the purpose of these presentations. Thank you very much for listening. I wish you a good day.